And welcome back. Well, kids are back to school and fall is knocking on the door, but the change in season can mean stuffy noses and sinus infections.
Allergies and colds can make us tired and make us less productive. So what's the solution? Dr. Madan Kandula is an ear, nose, and throat expert, and he says that solution might be easier than you think, which is good news. Good morning to you.
Good to see you.
My daughter, we were struggling with whether or not she should stay home from school today because the cold hit her. I've been feeling allergies worse this year than in years past.
Painful.
With the change of the seasons. It seems like it's now hitting everybody.
Yeah, this is prime time. You know, a lot of folks, when they find out I'm an ENT, they think about like, oh, the spring, and that's certainly a bad time of year for folks from an allergy standpoint. But the fall tends to be sort of the perfect storm. So the weather's changing. So what that means is there's things in the environment that you're breathing in that are different in the summer and the spring. And so a lot of folks are allergic to like ragweed, things that are out this time of year. We're also because the weather's changing, you're inside more. You're inside more means you're sneezing and coughing and all the things that happen there, and all the germs get passed around. Kids are in school, and so that's not only, that same deal for them.
People again.
And kids, their parents. It's sort of this cycle of it starts now, and people, I think, are aware of that. And a lot of folks who deal with sinus infections, for instance, know, winter's coming and it's going to be a bad time, and it is. And it's always the worst time of year in this like in the northern environment that we're in.
So all those things kind of come together. Is that what causes then an actual sinus infection?
No, well, it's like the root cause for a sinus infection is that the sinus opening shut down. So we all have sinuses. I think a lot of people don't know this, but they're just air-filled pockets in your skull. They have little passageways into the nose, teeny passageways, and if those passageways are too tight for people, that puts them on the edge of trouble, and then you get a cold or you get allergies, and what was tight shuts down. That's what causes a sinus infection. So it's the anatomy shutting down that traps somebody, and the problem is once those areas shut down, then you're in trouble, and it's a matter of how do you get out of trouble, and a lot of folks turn to things that just don't work for them.
Yeah.
I for many, many years had sinus infections all the time, but I think a lot lot of people who've never had them before aren't sure that they're even having one. So what do you tell people to look for? What are the signs?
Yeah, I mean, sometimes it's obvious. So if you have like a full-blown acute sinusitis is what we call it, like an active sinus infection, it's miserable. It feels like your head's pounding. You're blowing out tons of nasty stuff.
Pressure.
But a lot of folks more folks suffer with a chronic sinus infection. So same issues. Sinus passageways are too narrow. Things aren't draining properly. And then you get chronic inflammation in the sinuses and into the nose. And it just is this sort of descent in your quality of life. You're stuffy, you're not breathing well, you're not sleeping well, you have headaches, you've got drainage, all those sorts of things that you don't necessarily put together because it tends to happen gradually. And so a lot of folks get sort of lulled in this false sense that, oh, I'm like I was, and you're not. Once you kind of fall down that pathway, it's no fun. And then for those folks who have chronic sinus infections, this time of year can lead to active infections on top of those. It's sort of this, like I said, it's a perfect storm of trouble.
Layers.
Exactly. But you don't need to suffer, I guess, is the point of what we're talking about today.
Well, yeah, because a lot of people have their go-to nasal spray or the pills that they like to use, but there's better solutions.
There are. Well, if those things are working, that's fine. Okay. Most of the time, they're not. So most of the time, I think the challenge in this day and age is all those medications back in the old days used to be or prescriptions. So you had to go talk to a physician and talk about your symptoms, and then they would be able to kind of find the right fit for you. Now you're left in the pharmacy aisle just sitting there scratching your head looking at it's hundreds and hundreds of medications, and you're like, okay, what do I pick off here?
Right.
And unfortunately, likely whatever you're going to pick isn't going to work. If there were if there were good solutions there would be a handful. There wouldn't be 100. And so the reality for folks, another sort of simple truth that needs to be told is if you have these issues, if you have nose issues, blockage, and sinus infections, allergy issues, it's one of two things. It's either the anatomy is too tight or the lining is irritated, and most folks have both of those things going on. So if you've got both of those things going on, you could try to spray something in your nose, you can take a pill, but if the anatomy is not open, you're not going to get anywhere.
No, really.
And that's where a lot of folks feel like they're just spinning in circles.
How long does it take to do the type of procedure that opens that up and gives you the relief that you're talking about?
Yeah,
if it's an anatomical
It's really
issue?
quick. I mean, that's where back in the old days there were two options. One is suffer, two is surgery. Now there's this middle path, which is a big pathway. So we have office-based options for folks who have sinus infections. We have pathways for folks who just have blocked up noses. We have a new pathway pathway for folks who have just a chronically irritated nose or allergy issue. So we're talking literally minutes. So to the sort of last procedure I was talking about takes 60 seconds to do. To do
Wow.
balloon sinuplasty, which is something we've talked about in the past, which is opening the sinus passages up, that's 10 minutes, 15 minutes. So we're talking a few minutes. We're talking in the office, really no downtime. So you're able to get back to your life. A lot of times that was the struggle for folks trying to figure out, is this bad enough that I should do something about it? And the good news nowadays is the bar is lowered, where if it's impacting you, you should do something about it. And really now is the time of year, both as far as this is when things change. It's also, you know, the calendar's turning, the end of the year is in sight, you know, football season's upon us. And so it's one of those,
Yeah.
you know, a lot of folks
Get it done.
You know, get it done. Your deductible for a lot
Yeah.
of folks is met, and that's a big factor. And so
It
some folks
is.
are sort of bashful about that, thinking, oh, is this really, you know, the right rationale?
Yes.
I say, yes,
It is.
You know, there's a reason
Use
that's
that to your
there.
benefit,
Absolutely.
right?
And if this is a time you're going to, you know, sort of take care of yourself, if it's financially feasible, that's an easier way to make it happen.
Absolutely. You can schedule an appointment at adventnose.com in like 60 seconds or less. There's all the locations on your screen. So one near you for Advent: Wauwatosa, Mequon, Lake Country, Pleasant Prairie, and Oak Creek. The phone number is 414-771-6780, where you can schedule an appointment there. info@adventnose.com is the email. Thanks so much, doctor.
Thanks for having me.
Oh, it's good
Thank
to
you.
see you.
Get it taken care of.
Yeah,
Yes.
that's right.